Hello, good morning viewers at home and around the world. We're happy to be back today on Health Matter on WAP TV. This morning, we'll be looking at heart attack, acute myocardial infarction. That's the medical name for it. And with me in the building this morning is an expert in the field, in the person of Professor Kamar Adeleke. He is an interventional cardiologist. He is also the founder of Tri-State Cardiovascular Institute. Prof, you're welcome to the studio.
Good morning. Thank you for having me.
Yeah, thank you very much. Yeah. Now, for those of us who may not know, heart attack, as the name simply means, is a disease or is a cardiovascular event, is an acute event that affects the heart and, of course, the blood vessels. What is heart attack? Myocardial infarction. This happens when a particular or more areas in the heart fails to get enough blood. When you have a blockage of, usually the heart pumps blood to every part of the body, okay? But the heart itself gets its own supply from a group of arteries that are called coronary arteries. Now, when some of these arteries get blocked by any means and a section of the heart gets deprived of blood as a result of this blockage, that area that it covers, the tissues there, the heart muscles will begin to die. And that is what heart attack is all about. But we have an expert in the building who will dissect this topic and tell us what we need to know. There are risk factors that can actually predispose one to having heart attack. Some of them are genetic, the ones that you can inherit from your parents, while some others could also be acquired along the line. Okay, so at this stage, I would like to yield the floor to the interventional cardiologist we have in the house to do justice to the topic. So, Prof, in a way we'll understand, the viewers will understand, please simplify heart attack so that each and every one of our viewers at home and any part of the world will be able to have a true grasp of this topic. Thank you very much, sir.
Thank you very much, Doctor. And thank you to WAP TV for having me at the platform today. Well, as you said, heart attack is the damage to the heart muscle. And that usually occurs when there is lack of blood flow. And as you said, there are so many reasons that make people have heart attack or predispose you to having heart attack. One notably you mentioned was the genetics, which is true. But we find out that the environmental factors also play a lot of roles in heart attack. And many people thought that there's no heart attack in Nigeria before. Just this week, I had about 3 of them that came into the hospital. One is a 58-year-old man that just been having chest pain. Not really that terribly chest pain to start with. Went to the hospital nearby, around here, and unfortunately was treated for pneumonia and was there for about 5 days. Other doctor came to see him, and they were just giving him morphine. This patient finally left to come to Tri-State, and that was 2 days ago. And only to find out, when I look at the EKG and talk to him, that he was having a heart attack. The heart muscle was already damaging. I took him to the cath lab, and there we found out that he had 99% blockages of 2 major arteries. Wow. We put the stent. The guy is so emotional and very, very emotional, crying, and he got discharged home this morning. So the heart attack is a big thing in Nigeria. If you look at our demographics, particularly you're talking of the middle class and the upper class, if you look at number 1 cause of death today, it's actually a heart disease. Number 2 is stroke. And number 3 is cancer, in that order. So it's very common, more common than we thought. And I've had so many patients in different ages, as young as 30-something, as high as about 60-something. So this heart disease can occur and can happen. Now, what predisposes to heart disease, as you said, genetics, but environmental factors. That's why I always tell people you must know your numbers. We know that this is the disease of the Western world. However, this has now been imported to our society because our lifestyle already mirror, the lifestyle of the Western world. High blood pressure, diabetes, high cholesterol, sedentary life, because many years ago, everybody have to walk so many miles to get to work, to get to school. But today, we are so privileged in our society that people can even drive, as I always say, from their bedroom to the bathroom. Nobody wants to exercise anymore. And we find that the exercise actually do help. Stress, look at our society as well. The stress is so incredible. So when you look at all these risk factors, they are the one that actually contributes, to the heart attack. There's one major environmental factor that we have in Western world that I'm so happy I don't see very commonly in Nigeria, and that is cigarette smoking, because it's a very, very major one. So if you control all these risk factors you are not obese, you exercise, and your blood pressure and your cholesterol is controlled, your risk of having a heart attack is very low, even though you may genetically predispose to it.
Thank you very much. Thank you very much, Prof. Now, we do know that some heart attacks are silent. There are some silent ones that may not give any particular warning symptoms. Now, for those that can give symptoms, what should we expect to see?
So, 5%, 5 out of 100 of people who have significant heart attack will not have any symptoms. They will just die suddenly.
Wow.
No symptoms. They just find out that these people are kind of very okay. Yesterday they went to bed and suddenly they were gone. So the majority of people, thank God, they will have symptoms. Typical symptoms you expect, are the symptoms of chest pain. People will say that I have chest pain, and the chest pain can be typical or atypical. When you look at the chest pain, people say, what, every time I do something or I walk maybe, I can walk about a mile or a kilometer before, but suddenly now I only walk about 1/4 of a mile, then I have chest pain. Then I have to stop. Once I stop, the chest pain goes away. That is typical heart chest pain. Some people may not have that kind of chest pain. I've had a young lady, 35 years old, who was having abdominal pain, a paramedic in America, who turned out to be heart attack. People can just have only difficulty breathing. They were okay walking or running. Suddenly now they just have difficulty breathing. Some people, it's just tiredness, that I just feel tired every time I do something. And some people, they just say, I'm just not myself. So I always say you are your own best doctor. Anytime that something doesn't go well with you, you have to think about it, particularly certain category of people, diabetic and then females. They may have, the symptoms of that is not typical of the heart attack, of the heart disease, and yet, they're having a heart attack. So whenever you have anything, even just dizziness or palpitation, just get yourself checked out.
Thank you very much. Thank you very much. Now, we do know that the risk is more in males than females. Why is this so?
So that's a very good, God Almighty just know how he wanted to protect our females, because they go through a lot, from being, carrying us during pregnancy and everything. Now, it turned out that women have protective effect for the heart attack than the male, and the reason it turned out to be hormonal. It turned out that the estrogen that they produce during their menstruation period protect them from having a heart attack. And the effect of that estrogen is actually the same effect as you see with the cholesterol medication. It lowers their total cholesterol. It lowers their bad cholesterol, which is the LDL. It increases their good cholesterol, the HDL, and lower one of the bad cholesterol called triglyceride. However, the very moment they go menopause, then the risk is the same. The risk is the same as the men. So the young age, menstruation period, do protect them for that reason.
Thank you very much. You mentioned cigarette smoking as one of the risk factors. What about harmful use of alcohol? Overweight and obesity, do they play a role?
Well, that's actually a very good question. Let me take obesity first. Obesity has been shown, if you take two identical twins, twin A, who has what they call the ideal body weight, versus twin B, who is obese. In other words, the body mass index, or BMI, or whatever we call it, is higher than 35. The twin B, who is obese, is going to die sooner than the twin A, just by basis of the obesity. Now, the obese person is also the one that tend to really have diabetes, that tend to have high cholesterol, that tend to have high blood pressure, and they are the one that tend to really not doing any kind of exercise. So obesity by itself, can cause, the heart disease because of that reasons. Now, the cigarette smoking, what was the question on that one?
Yes, harmful use of alcohol. Does it have
alcohol.
A role to play as a risk factor?
Alcohol is kind of a, double-edged sword.
I like that.
The alcohol has been shown a moderate consumption of alcohol, particularly when you're talking of the red wine. Red wine is better than the white wine. White wine, however, is better than, just beer. But beer may have a little bit of benefit as well. But it's not the way we drink beer, So those alcohol, particularly the red wine, they tend to really reduce cholesterol, just like the estrogen that I talk about, does. Now, if you don't drink alcohol, I'm not advocating to go and be taking and go on a binge, but, grape juice, not grapefruit, grape juice has been shown to do the same thing. Because the grape juice, if you look at it, is actually what is used to make wine. So if you drink that one, that will do. Now, when you drink alcohol into excess, that one tends to really now cause another problem for the heart. And typically what it does is that it depresses the functionality of the heart. And the heart becomes weak, and you go into heart failure to the point whereby you may need heart transplant. Nonetheless, the alcohol, a moderate drink of alcohol. The French people, that's where the study comes in. For every meal they have, you see that they have a glass of wine, with it. So that one is going to be beneficial.
Yeah. On this note, I would like to open the phone lines so that our viewers at home will be able to make contributions or probably ask questions, should there be any. Okay, so we left it when we went on the break. It was talking about the harmful use of alcohol. Okay, now we're back on. I would like to ask a question that has to do with the diagnosis. How can we know? How can somebody, a layman, know that he or she is having this problem? Apart from the symptoms you have enumerated, besides that, are there immediate action that someone can take at home, okay, self-help, before the person probably gets to hospital? In this part of the world, we do not have the luxury of probably calling a particular number and then ambulance arrives within seconds to evacuate such a patient to the hospital. What can we do if one is suspected to be having this heart attack?
Thank you so much for that one. The time is very, very important. The timing of getting to the hospital is very important. As you said, in the Western world, when someone is having a chest pain of any kind, you pick up the telephone, you dial 911, and you are guaranteed that within 5 minutes, the ambulance is already at your house. And within that time that they get to your house, they're already talking to us, and we are implementing the treatment. We call it, on-the-field treatment until you get to the hospital. We call something which is called D2B, capital D, number 2, and capital B. That means door to balloon. In other words, from the time that you get to the emergency room, to the time we open up the artery that is causing heart attack. That is what we call. And the benchmark is 90 minutes. So that tells you, how important it is to get into the hospital. You're not having chest pain of heart attack and stay at home. However, there are certain common sense things you can do, particularly those who already had the symptom before, who have other issues. One is make sure that you are so exposed to the air, to the oxygen. Don't get yourself in a place, that is very close. Two, make sure the place is not hot or humid. So if you have fan, have the fan on. Number three, if you are one of those people that have the opportunity to have the...
Just a minute, sir. Bello from Adamawa. Good morning, Mr. Bello.
Good morning, sir.
Yeah. We're pleased to have you.
Thank you, sir. Can I go ahead? Okay.
Yes, go ahead. You have the floor.
Okay. Good morning once again to the Prof.
Good morning.
To the doctor. Yeah, good morning.
Yeah, thank you.
My question is just to ask whether, apart from the symptoms one can see, whether the symptoms as enumerated by the Prof, is there any test one can do by way of scanning or any medical examination which he can do just to be sure whether he has the disease or not? Thank you very much, sir.
Thank you very much for that very important question.
Work, sir.
Thank you. We appreciate you.
Thank you, Mr. Bello. That is a very, very important question you just raised. And that's why I said you must know your number. You must know your number. You don't want to have problem, you want to prevent the problem. And the only way you're going to do that is to have what they call the routine visit to the doctor. You must know what your blood pressure level is. You must. And in this day and age, everybody have this little machine, a gadget at home that you can actually check, your blood pressure. You must know your cholesterol. And when you go to the doctor, ask them, what is my blood pressure number? They give it to you. Normal blood pressure is anything less than or equal to 130/85. If they say your blood pressure is 140/90, you say, is this high or is it normal? They say it is high. What do we need to do about it? That's your question. Two, your cholesterol level. And don't take it from the doctor to say, oh, your cholesterol is fine. Get the number. Get that fact number. Normal cholesterol, if you are not diabetic or have heart disease, should be less than 200 milligram per deciliter. Your good cholesterol, which prevents you, we call it HDL, that prevents you from having a heart attack. That should be more than 40 if you're a male, and it should be more than 50 if you're a female. The LDL, which is the bad cholesterol, should be less than 100 for everybody. And another one called triglycerides should be less than 150. So you should know all these numbers, not just your total cholesterol. Now, also you should know your sugar. There's a test that we do, because you may have been to the doctor's office when you already ate, but you can do this test called hemoglobin A1C. Hemoglobin A1C is going to show how good your sugar has been in the past 3 months. So you need to know that. So now, if you know all, and then you, as we say, your BMI, if all those numbers are normal and you are doing your daily exercise, walking, you don't need to do vigorous exercise, walking. The study shows that just walking 1 mile a day, 5 days a week, you can actually increase your quality life expectancy by almost about 4 years to 5 years. If you do it 3 days a week, you can do that for about 2.5 years. So that is exercise is also very important. If you do that, we will be fine.
Just a minute, Prof. David from Lagos. David, good morning.
Yes.
How are you today?
Good morning, sir.
Yeah, thank you very much. Please go ahead.
Yes. I'm watching your program right now on the TV about health matter.
Thank you very much.
So I want to ask a question. Sometimes I have a kind of very serious breathing. I breathe so high, so high. It comes once a time. So, in fact, the last time I was having was 2 months ago. I find it so difficult to breathe, Sam, in the evening time. So even up to the extent that I have to look for where there is breeze, because sometimes I don't have light, and my generator sometimes don't function, so I have to open the window down and find it difficult to breathe. So I want to ask, what are the causes of this? Because it looks so strange to me. What are the causes? Thank you very much.
Thank you very much. How old are you, Mr. David?
46.
Okay, thank you very much. Prof will take the question.
Thank you, Mr. David. Sorry, I have to ask another question. Do you know how much you weigh?
It's gone. We couldn't get that, Prof. Sorry about that.
That's okay. Well, Mr. David, the key thing is that you are very young, but you are not too young to have heart disease. The heart disease can occur, from, a day-old, 2-day-old baby. The youngest kid that we have done is a 3 days old, open heart surgery. So it's possible. However, I'm asking about your weight, because that is going to help me. Now, if you are obese or overweight, it could be because of that. It could be because of what we call, sleep apnea, pulmonary hypertension. When people have, problem, sleeping, and, you have to do a special test to check that one. It could be because of blood clots to the lungs. But it also can be because of the high blood pressure. If your blood pressure, because your blood pressure will go up as you are walking. So if your blood pressure is so high, you will have difficulty breathing. It can be because of the weak heart muscle, and it can also be because of what we've been talking about, blockages of the artery. You don't stay at home at this point. You scared me. You need to go to a doctor, a professional doctor, and then get in.
Thank you very much. It can also be because as a result of asthma. Uche from Abuja, good morning.
Yeah, good morning, Prof. Good morning.
Thank you very much. So nice to have you.
Yeah, I'm enjoying the program, sir.
Thank you very much. We appreciate you.
Yes. There's a problem I'm having here right now. Since 3 days ago, I'm having a back pain from my lumbar side back. And I've taken pain relief and other things. So I'm still continue having the pain even till yesterday night. So I don't know what is the cause. This is giving me a trouble since the morning now that I woke up.
Okay, how old are you?
And luckily, I'm 42 years.
Okay, your weight. You have an idea?
My weight,
yes, what you weigh?
75, sometimes 74.
Okay, thank you very much. Prof will take the question.
Now, this pain you are having, when do you have the pain? Is it after eating, or just when you are in bed, or when you just get up?
No, even though I'm sitting down now, I'm still having the pain.
Okay.
I'm lying down, I'm having the pain. I'm walking, I'm having the pain.
Okay, the pain never goes away.
No, I'm still having it right now.
Okay, I would suggest that you get to the hospital, please, because it's very difficult to discern as to, because the pain can be from the GI, from the stomach, but it also can be from the heart. You don't sit down, as Doc said before, you don't sit down and be having chest pain. That means that chest pain may be becoming unstable. So you need to really get to the hospital, please, as soon as possible. They will do the EKG, they will take your history, do the EKG, do blood test, and make sure that everything is okay.
Thank you very much, Prof. Now, what are the tests? What are the tests that we can look out for? Okay, if we want to make a diagnosis, what's the gold standard? You've mentioned EKG. In this part of the world, we know it better as ECG. Okay, apart from ECG, what other investigations can be done? That's one. Number two, can we advise our viewers to probably use baby aspirin if they suspect they're having heart attack? Is it advisable?
So the ECG, you are right. Actually, you guys are right. It's called ECG, electrocardiogram. Yes. But in America, we call it EKG because we are using the German, yes, terminology. But so the EKG should be done. Also, too, if it is just a screen.
Just a minute. Abraham from Cross River. Good morning, sir. Oh my God, we lost him. Okay, go ahead.
Yeah. So in the hospital, in the screening, we do what they call the echocardiogram, which is the ultrasound of the heart. But more importantly is to do what they call the stretch test, whereby we put you on the treadmill and then you walk and then we check your ECG during that time and then we see whether or not you have chest pain. Now, if you are having chest pain at the time you come to the hospital, then we do blood tests. The blood tests are the chemical, we call it CPK or troponin, which come from the heart, and that is telling us indication that the heart may be getting damaged.
Thank you very much. Jennifer from Cross River,
No,
good morning.
Television. But talking about health, heart attack, sometimes I'll sit down like this and my heart will be causing me. So my heart will be causing me. So I don't know what is always because, and I find it difficult to breathe.
Okay, what side of your body do you usually feel the pains?
My chest.
Is it the left or the right side?
It's the right hand side of my chest.
Okay. How old are you, Miss Jennifer? How old are you? 35. 25. Okay, thank you very much. What do you weigh?
50.
Okay, thank you very much. Prof will take the question.
So the pain that you are describing very unlikely to be coming from the heart. Most of the time, we call it probably what they call the costochondritis. In other words, the pain is coming from the junction of the rib cage and then the other bones, because it's cartilage, they get inflamed. Particularly, of course, during the time that you are, about to having your period, or when it is cold, or when you are exposed to air condition. So also too, as Doc said before, asthma can also cause, chest pain, particularly in the age group like you. But I think, you need to really still see a doctor to be evaluated to make sure, it's nothing else.
Thank you very much. You mentioned ECG, you mentioned stress test, okay, and at the beginning you also mentioned cardiac catheterization. Can you throw more light on this, sir? And how common is it in Nigeria? Are there a lot of places where it can be done?
So yes, heart catheterization. Yesterday I did 4, of them.
Wow.
And every one of them had blockages that we had to fix with stents. And one of them had to go for, open heart surgery because it got too many blockages everywhere. So the heart, the cath lab is we have them in Nigeria. The first one in Nigeria actually was at Reddington Hospital, run at that time by my colleague, Yemi Johnson. Since then, we had one at Tri-State, which we started at Babcock, but now we have, in Lekki. So Afe Babalola University have it. They have almost about 3 of them or 4 now in Lagos, and in Abuja, I think about 2 or 3, of cath lab. So the cath lab, from one when I first came, we have asked so many of them because it's so important. There's nothing that is going to help you, when you're having a heart attack than the cath lab. You must be there because that's the only way you're going to see the blockage. So it is very simple how it is done. We take you to this to this room that have this machine. It almost look like an operating room theater. We will clean the area. Sometimes we can go through your wrist, we can go through your arm, or we can go through the groin, the blood vessel. And then we will clean the area. We put a tiny catheter there.
Just a minute. We have another caller, Ebube from Plateau.
Like yesterday, I checked it. It is 129. I don't know how you be okay for somebody.
Can you take it again?
I said this I checked it yesterday. It was 129. I don't know whether is it okay or it's not okay. I said let me ask.
It's not going to be only one figure. 129 and what did you get?
78.
Okay. How old are you, sir?
I'm 38.
Okay. Your weight?
My weight is 50.
Okay. Thank you very much.
So as I told you before, the blood pressure, normal blood pressure is anything less than or equal to 130/85. High blood pressure is defined as anything greater than or equal to 140/90. There's a new trial that says that, maybe we want to get our blood pressure below 120/70. But by the number you told me, that is correct. But I want to, point out something, that the blood pressure is not a flat line. Okay, it tends to undulate. So it has what they call the peak, it has what they call the trough. So when you take it, you are taking at that point in time. You don't know whether you are at the peak or you are at the trough. So, or in between. You know, that one number, when you took it, it's okay, but we need to get it multiple times. That's the reason why the new test that we do now is called ambulatory blood pressure, whereby we hook it on to you for 24 hours, and that will give us a good number, you know, blood pressure readings.
Yeah, thank you very much. Talking about the pre-hospital care, I asked a question, is it advisable to ask people who probably suspect they're having heart attack to probably take baby aspirin? If it's advisable, what should be the dosage?
Thank you. That's a very good question. If you look at the medication that have been shown to improve, you know, the survivability or reduction in the amount of damage you do to your heart, aspirin is number one. So it is advisable if you're at home, you're having that kind of chest pain. Remember, and I told you, chest pain can come from the, you know, belly, can come from the heart. If it's coming from the heart, you take the aspirin, that is going to be really great. Baby aspirin will be fine, which is 81 milligrams or 75
yes,
milligrams.
75
You know,
milligrams.
that will be fine. If you only have 300 milligrams, take it. You know, any amount of aspirin is better than nothing.
Still talking about heart attack, Chief, I want to ask, are there warning signs that could be seen days and probably hours before one suffers a heart attack in some situations?
Yeah, again, as I said, majority of people, thank God, they will have symptoms. The problem is that people tend to ignore that symptomatology. So you do, you know, and as I also said, 5% of people who have significant heart disease or will die, they will not have symptoms. So 95% will have symptoms. Those symptoms are warning sign. Warning sign like, I'm just having that chest pain. This chest pain is coming, you know, it's coming with exhaustion. It's going to my neck, it's going to my shoulder. I'm becoming nauseous with you, I'm feeling sweaty with it. You know, when I'm doing something that, you know, even the female that are cooking, you know they can go and cook or running after the kid. Now
Just a minute. Isaac from Abuja, good morning.
Good morning, thank you.
How are you today?
I'm good.
Yeah, thank you very much.
Thank you so much for the enlightenment. And
Yeah,
the
please go ahead.
about the heart attack. I want to ask a question. What could it really mean, or could it be something normal in some people to have the systolic blood pressure a little higher than 120? No, a little lower than 120, and then the diastolic being a bit higher than 84, 85, up to 89. What could that be after taking it randomly?
Okay.
Sometimes 118 over 87. You could have sometimes 114 over 90. What could that really be?
So the high blood pressure have two components, as you said. The top one, we call it systolic. The bottom one, we call it diastolic. And systolic, both of them is effect on the blood vessel. So think about it. You have your blood vessel, and the heart has to pump the blood into that blood vessel. So the pressure that the heart have to exert to pump the blood out to that blood pressure, to the vessel, is called systolic. So when it is too high, that is problematic. The bottom one is called diastolic. That is when the heart is actually resting, trying to fill the tank before it starts pumping. And that is again the pressure that is reflection on the blood vessel. So either of them, they are problematic. You can have what they call hypertension, which is just the top one, systolic, or you can have what they call the bottom one, which is called diastolic hypertension, or you can have both systolic and diastolic hypertension. What we do know is that both of them are very problematic. The top one, that is the one that causes stroke, kidney failure, heart failure, and even the other organ failure. The bottom one, because the heart, the coronary, that is the one that actually fills the heart itself. That is when that blood vessel is being getting the blood. So that diastolic blood pressure, when it is too high, can actually cause a heart attack, even if you don't have blockages of the artery. So both of them are very important. They have to be low. The diastolic, the bottom one, must be less than 85. Now we are thinking it even should be less than 70, and the top one should be less than 140.
Good morning, Godfrey from Nasarawa. Hello, can you take your question again, Mr. Godfrey?
I said,
Go ahead.
my name is Godfrey Eko. I'm from Nasarawa State, and I hear the program right now on the radio concerning the heart attack. You know, there are so many symptoms that we normally encounter, such as headache, chest pain, and whatever. I don't know whether it's part of the program and as a result of the heart attack, because someone we even know you don't know if whether the BP is high or not. So I don't know whether high BP can contribute to what we are saying.
Thank you very much. He wants to find out if hypertension can contribute to heart attack.
Oh, definitely, definitely. High blood pressure, during the time that you're having high blood pressure, you can have a heart attack during that time. You can have stroke. You can have kidney failure. Yes, the high blood pressure definitely can contribute to the heart attack. And the high blood pressure is very important because if you look at, in the sub-Saharan African, 1 in 3 sub-Saharan African above the age of 18 will have high blood pressure. That's why it's so important for us to take care of it. We must screen for it.
Thank you very much. Now, one of the things you have advised us to do is to know our numbers. And in knowing our numbers, that brings us to going for tests that will enable us to know our cholesterol as well as hypertension and others. Now, how can we bring down the level of cholesterol in our body? I know some drugs can be used to do so. How long should one take such drugs? Do we need to be on it for a lifetime? Thank you very much.
So the cholesterol is an important...
Let's take this question. Okay. Kelechi from Benue. We'll come back to that, Prof. How are you this morning?
I'm fine. Good morning, sir.
Yeah, good morning. Please go ahead.
Please, what is the cause of when someone is having constant headache?
Okay. Constant headache.
Yes, sir.
This headache, does it occur at any particular time?
It doesn't occur. Sometimes when I take a drug, it will stop. Then sometimes it will come back again.
Okay. And you have an idea of your BP?
No.
Okay. How old are you?
I'm 32.
Okay. Thank you very much. What about your weight?
I weigh 60.
Okay, 60 kg. Okay, Prof. He has a recurrent headache. What could be the reason?
So the headache is, the number one that I would be worried about is the blood pressure, as you asked that question. Blood pressure will cause headache. Headache typically will be the stroke warning. So you need to know the blood pressure. Number two, he asks you the question, what time of the day? Because there's something we call the, tension headache, which can occur because you already did so much work during the daytime and then you get home at night and then all those tensions just come. And then you can have that. The headache can be because of something within the brain itself, occupying the brain. That includes the aneurysm, even the tumor. So there's maybe benign tumor. So you must really have to be evaluated. But I think the most important one is the blood pressure that you need to check.
Thank you very much. So back to what drugs can bring down or lower cholesterol in the body. Do people who are on such drugs, do they need to be on it for a lifetime or they need to stop after a while?
So the cholesterol is an interesting one too. This is it. You eat food, you eat cholesterol. The cholesterol that you eat is too big when it gets to your stomach to be absorbed. So that cholesterol has to be broken down into pieces, into the blood building block. And then that cholesterol now gets absorbed into the blood. Then from there now it goes to your liver, and in your liver you make your own cholesterol. And that cholesterol is now what you pump out that we measure. So the cholesterol that we measure when we do the blood test is actually not the same one that you eat. It's the one that you produce by yourself, by your own liver. So how do you, control cholesterol? Number one is to minimize the amount that you eat, right? So, but some people, they can eat as much as they want, and yet they don't have, high cholesterol. The second one is that, okay, if you eat it, right? Remember I told you that you have to be broken down into pieces. You can bind it with some medication that will prevent it from, being broken down into pieces. After a while, you stool it away. And the third one is to give the medication that goes into your liver that decreases the production of the cholesterol. Any of those, the one for the liver, we call them statin. They are much, much better than any of the other cholesterol medication. Now, should you take it? Well, there's something we call the primary prevention, and there's something we call the secondary prevention. Primary prevention, that means that you never had, say, cancer of the lungs before, so you don't want to have cancer of the lung. We say, guess what? You should not smoke, right? Or be exposed to smoking. Secondary prevention is that, now you already had the cancer before, then you say you must not smoke again. So that is the secondary prevention. If you already had a heart attack or stroke before, the study is very clear. You must be on cholesterol medication for the rest of your life.
Thank you.
Unless you have the side effects. Yeah.
Thank you very much. I'm afraid time is up. This is how far we can go for today's program. Prof, you've done so well. We appreciate you for coming, and hopefully we should be able to bring you back some other time. Thank you very much, Prof.
I want to say thank you to Medtronics for giving the opportunity, particularly my good friend Mohammed, who woke me up to bring me this morning. Thank you.